Hello, I'm Shipra Bansal, and I'm delighted to be sharing with you today a curricular innovation at SOMA, where we are teaching nutrition via a culinary workshop. Despite diet being the leading cause of poor health, nutrition is not tested on the board exams and hence often not stressed in medical school curricula. Research also consistently shows that most practicing physicians do not feel trained in providing nutritional counseling to patients. Given a small time slot, this exercise successfully engaged students to think about food in a therapeutic manner for patients, as well as in their personal lives. We were inspired to create this assignment to provide real-life nutritional instruction that engages students and is practical for patient care. This innovation also aimed to help students quickly take basic medical science and apply it clinically, a task that is generally quite challenging for students, especially in their first year. The activity used experiential learning by providing students with a brief vodcast introduction to culinary medicine. The presentation outlined the rationale for culinary medicine, as well as practical ways to improve nutritional value in foods, particularly for those with diabetes and cardiovascular disease. Students were then given a patient scenario and asked to create a meal to best meet this patient's needs in terms of preferences, practicality, and nutritional therapeutic value. The project is innovative due to its high level of student engagement, as well as how it was adapted during COVID. Students attended Zoom sessions with their cameras facing their kitchens. They were given an hour to prepare a dish and then were asked to present their item to a panel of judges describing their choice of food items, preparation technique, and efforts to meet patient preferences and culinary skill. Winning students were given a Culinary Champion apron. The beauty of this exercise is that it is quite easy for interested faculty members to implement. A pre-lecture that presents culinary medicine is required. Staff is needed to create baggies of food items to hand out to students. Alternatively, students can purchase all of the items on their own. This activity uses the students' own kitchens and does not require any recipe prep. It can be done without a budget if needed and will only require 3 to 4 hours of student instruction and activity time. The cost of food items per student is less than $5. Because the activity utilizes students' kitchens and can potentially be based entirely on food items students purchase themselves, this activity should be relatively easy to scale. During COVID, faculty judges used breakout rooms during the cooking sessions to increase student and faculty interaction. Faculty availability would be the greatest factor in scaling this project. This activity impacted faculty, staff, and students in that it was a wonderful way for everyone to be interacting differently than they normally would. Particularly during the food prep time, students were able to interact with each other as well as with faculty and staff, perhaps more than they had all year due to COVID. Further, by bringing in both basic science and clinical faculty, as well as staff to be judges, there were opportunities to create new connections. Student feedback at the end of the cardiopulmonary course, where this activity was housed, suggested strong student engagement and interest in the workshop specifically. Also, a group of students were inspired from this activity to create fact sheets for their peers to use with patients at the community health centers. The fact sheets have now been accepted by the community campuses to use during patient care. This activity also aligns with ATSU's core professional attributes. It expands critical thinking by asking students to apply basic nutritional science information to a clinical scenario. Secondly, many medical students find it difficult to translate the medical jargon they learn into patient-friendly language. In this activity, they are asked to explain the health properties of their dish in layperson's language. Finally, students were required to take social determinants of health into consideration to create a dish that was practical for the patient based on resources and skills. Thank you so much for your time and your consideration.